Hi, I'm Justin Lin, the Senior Spinal Consultant here at the Brisbane Spine Clinic. Today I'm going to talk to you about a phenomenon that I see quite a lot in my clinical practice. It's called the failed back surgery syndrome. For most of my patients that's gone through back surgery, they've gone through one of the two types. So the first type is what we call decompression type surgery. So this kind of surgery is usually aimed at removing the structure that could be compressing onto your spinal nerve that can cause the pain. The second type is what the surgeons usually refer to as a fusion type surgery. So these kind of surgeries are designed to fuse two spinal levels completely together so they don't move at all. Now that's done just because they believe that by stabilizing the unstable structures, that is a source of pain which could remove your pain. Now, but the problem is, if what the specialist has explained to my patients, if that were true, then why would the pain still come back after surgery? And this phenomenon is what we call a failed back surgery syndrome. Now, first of all, before we go on further, we need to understand a couple of things. So, first thing is, back pain, sciatica, and chronic spinal pain is a very complex entity. And a lot of times, in order to get good results, we really do need to look past the anatomy, the surgery, the MRIs, and the scans. And also, a lot of the times when patients start to experience these symptoms, it may not be the anatomy that was the cause. Just to name a few possible factors that could lead to my patient's problem. For example, poor spinal movement patterns, poor muscle control, weight being an issue. These are all factors, just to name a few, that could lead to what's going on in my patient's spine. Now, while surgery is very good for a specific type of patient group, it doesn't solve the whole complex entity that sciatica and chronic back pain that is. So I think in order to target the proper aspects of the body to achieve a good result, we should be very thorough and look past, as I said before, the surgery and the scan. After surgery, obviously the way we move our body changes. So one of the examples that I see this happening is in patients that's gone under fusion surgeries, where they have two spinal levels that's completely not moving, and their body starts to put excessive load on the levels above and below, and that sometimes can be one of the reasons why patients don't get better from back surgeries. We understand it is very scary and very devastating for a patient to be recommended back surgery by the specialist, and I would agree that that should be the last line of defense that we should consider. However, here at the Brisbane Spine Clinic, we specialize in thorough, comprehensive assessments that will possibly identify the missing components to a good recovery, good results for our patients.